morning, everybody. Welcome back to Kalkstein Chiropractic. It's Dr. Warren here in Towson, Maryland. And today we've got Randy with us today. Randy is an avid golfer. He came in on June 4th with lower back pain, radicular pain into the hip, into the leg. And how long have you been experiencing that pain, Randy?
It started after the initial main event was the last Sunday in April, but it started about 2 months before that.
So lingering pain for about 2 months, and it increased because you try to get back out there and play, and try to work through it, and it aggravated it even worse.
Yeah.
And then that's when you kind of said, all right, well, if I can't play my game, then I need to take care of this, right? If I can't work
I just stopped at that point, yeah.
So, relatively speaking, his strength was good in his lower extremity. He had some weakness in his right hip flexors. Sometimes that can show up with pain just in the low back, because when we engage our hip flexor, we have to stabilize around our spine, and if the spine is in pain, we just go ahead and give out. So it's not true weakness; it's more referred from the pain. So in certain radiculopathy cases, there are pain traveling from the low back into the legs. You can have sensory problems that's where pain would be a thing, or a lack of sensory or light touch. But you can also have motor weakness. In his case, it was more of the sensory side of things. So he came in with that pain. We did an exam on him. When we compressed his low back, and it's a test called KEMPS. It was positive. He had irritation in the joints in his lower back. So let's talk about what we did with the event and how we're helping you. So you played this weekend. You played 9 holes of golf.
Right.
We talked about slowly getting back into it. I think this weekend maybe we talked about doing a par 3 course, but you were feeling, so
he's feeling pretty good.
I can't blame him. I'd probably do the same thing. So you were playing pretty well over the weekend. You just did a club lighter, swaying. There's
about a 3/4 swing type of thing, just nice and easy.
Yeah. So it was a little bit of a lighter go, but still was able to play, and I'm really happy with this progress. So we've been doing traction therapy, like you see what he's getting now. It's called lumbar decompression. He has this type of therapy for about 18 minutes. After he's finished here, he goes out and he's doing exercises. He's all the way at low back phase 5 now, I believe. So he's on the higher end in terms of some of the stability work he's been doing, but he's been working himself up to that point over the last month and a half. He's got a lot of motivation to get back and play, which is very helpful, I think, when he's goal-oriented that way, because he's done his exercises twice a day. He's come in and he's gotten treatment. And I think about 3 weeks ago, about a week and a half in, you had some soreness. You had a little bit of increase of symptoms over the weekend. That can happen with these type of cases, and what's really important that he just stayed committed to the treatment plan, because that is the trial of care. That is what we work through to see if it helps him through the process, and we did. We worked over that bump. I did a little more soft tissue work with you on that week to calm things down on the hip.
That did help.
That helped a lot. So we did some soft tissue work on his right hip, and so you'll get to watch his therapy here, as well as the low back exercises he's doing to help stabilize his core, so that when he goes and he's swinging, he's not rotating so much through his lower back. He's stabilizing through his core, so he can rotate through his shoulders, his thoracic spine, and open up through his hips a little bit more, and improve your game in the long run too.
Yeah.
So we're helping out with his back pain. We're going to work towards helping out with your golf game as well.
Right.
Right on.
Sounds good.
We'll be back.
Their practice is at home, okay?
Goes in. Good. On the push out, breathe in. Exhale in.
Good.
Good. Breathe out. Good. We'll slow that down a little bit. Bring the elbows all the way in. Hold. Catch up to your breath. Hold. Hold. Come back. Come back. Hold. Okay. So when you push out, you're going to breathe into my hands. So that push out. That. See how you give stability to your core? Exhale in as you bring it back in. Good. So breathe into my hands again as you push out. Good. Exhale out. You feel that?
Mm-hmm.
This is giving you support when you're in your most vulnerable position, is your breath. Good. So breathe in. Strength here. Good. Exhale. That's it, right? Just like that. Nice and slow now.
Oh, the dove too. When you straighten your leg,
Exactly. Keep the elbow straight the whole time. And if you can get all the way up, so when you're faces right up against the wall without compensating, without leaning back or anything like that. So stay sort of rotated now.
Welcome back, everybody. You just saw Randy go through his traction therapy, so he gets spinal decompression. It takes about 15 to 18 minutes, and then he goes in and does the core stabilization exercises that we have here. And we have varying levels 1 through 5, and he's been bumped up and is starting to do some of the higher level exercises to help. With all those exercises, we're really big on diaphragmatic breathing, core stabilization, and education through the process. So there's some form of mobility work, as well as a component of stability work, from the point of doing strengthening exercises. So a lot of our mobility work revolves around either extension and flexion of the spine, cat camel, those type of exercises. But now you're going to watch how I adjust him in here. So motion palpating, I'm feeling how his back is moving today, to see where to adjust him, to find the angles and the areas of stiffness that I need to work on here in the room. So my job now is to focus on giving him a treatment that I know from a clinical background will give him relief for this type of problem, as well as mobility in the whole chain. So working on mobility in the spine in general, as well as his clinical issue, his area that he has the problem, and how to best treat that from a manual therapy standpoint. Right. So we're going to show you how I adjust him. Take a breath in here for me, Randy. And easy exhale, relax your hips. Good. Good. Let the shoulders drop. Good. Let that fall. Take a breath in and exhale, let it go. All right. So I'm gonna have you come onto your right hip for me here, okay?
All right.
So I adjusted him at T6 in the middle of his thoracic spine. We're doing a little arm wrestle in there to figure out where the arms go.
Every time.
Every time. And then I'm gonna have your leg just come up here and rest.
Yeah.
Adjust his TL junction in the very first adjustment. That helps with mobility right at that intersection between the lumbar and the thoracic spine. And now I'm adjusting his ilium and sacrum, as well as L4, L5. So take a breath in for me. Easy exhale, relax. Good. And I'm going to push here. Randy, let me take you over.
Yep.
There you go. Good. And let that all fall here for me, right there. Good. Come up onto your back for me.
Yep.
Take your time. Good. Do me a favor, bend this knee here. Good. Just like that. And relax it. Okay?
Yep.
This allows him to relax a little bit more, gives him some support on the table. I'm going to check the mobility of his ankle. Good. I'm going to feel how his knee is moving in distraction. If there's tension in that system, I'll feel it come up there first, as well as the hip. So external rotation of the hip is what I'm going to focus on with this adjustment. Relax. Good. Good. Okay, go ahead and bend up here.
Yep.
Good. Now straighten out. So a little more stiffness in the ankle on this side.
Yeah.
So do you feel that?
I can feel it,
Yeah.
absolutely.
So I think patients get a feeling for it as I kind of work on some of these things. They'll say, I felt that coming almost. I felt that stiffness build up in the adjustment. And you can feel that in that what's called your mortise joint, or an ankle joint that helps you do this with your whole foot. Good. Good. And when I set it up, you'll feel a little cavitation or a pop if I'm in the right area. So that's why it's really important to motion palpate an area before you adjust it, because then you'll be more effective with your treatment. Good. And let this all drop in. Good. Good. And go ahead and roll onto your side. Face this way for me.
Yep.
Let's go ahead and bring this thing up.
Arm wrestle again.
Yeah, it's all good. We can arm wrestle in the morning. Take a breath in for me. Easy exhale. A little more extension here. Breathe in for me. And exhale. Good. Let that shoulder drop away. There we go. Right on your back. Hands on your stomach, take a deep breath in, exhale. Good. Good, now let everything relax in my hands, let your head fall all the way to your head. So I'm just waiting for his muscles to let go. If he's tense or if he has tension in the neck, I don't get a good joint assessment. I don't have a good end range of what is actually happening in his neck to know where to adjust him properly. And that can be voluntary. That can be involuntary, like say someone that's really just tense, having hands around their neck, or they don't want to get their neck adjusted, or they're nervous, or they're scared. So I just have to be patient with people because a lot of experiences are different for everybody when they come in. Randy's used to getting his neck worked on by me, so he falls into a relaxed state a lot easier. Good. So rotation stiffness at C0, C1 on the left, loose. A little bit more, good. And then you're gonna feel a little bit more on this side here. Let it drop, good. Now take a breath in for me, and exhale. Good, let it drop. There we go. Turn your head towards me, good. Over there. Now reach across, hold on to my opposite shoulder, Randy, good. Yep. Take a breath in, exhale, let it fall. And let that go. Good. Turn your head to your right for me. Good. And put that hand right on that first rib here. Alright. And reach across and hold. Good. And exhale. Good. A little bit more pressure on this side. Good. Nice. Alright.
Alright.
Nice work today.
Yeah,
Keep up the good exercise.
Alright.
Everybody, thanks for watching. If you have any questions, post below. Take care.